Hello, everyone. My name is Mohammed Ahmed. I'm the medical director at Kaizen Brain Center, which is a concierge brain health center based in San Diego. Today, I'll be talking to Dr. Jennifer Sumner, PhD, who's our lead neuropsychologist at Kaizen Brain Center, and she will walk us through a very important area in brain health, which focuses on cognitive fitness. So, Dr. Sumner, could you tell us what cognitive fitness is?
Yeah, let me start by giving an explanation of cognition. I think that word is used a lot and people don't understand it. So this phrase essentially means cognition means how our brains learn information, gain knowledge, and how we come to understand it. So when we talk about cognitive fitness, it's how we can find our optimal performance with thinking, gaining knowledge, and understanding it. So it may be how we process information, learn and remember things, or reason and problem solve.
Uh, so, when you say this, why do you think this is important in our day-to-day activities?
Yeah, good question. It's important for a number of reasons. You know, as we age, we're more likely to experience a number of major medical conditions, especially those that may affect brain functioning. So it's important that we maintain good brain health. It's our best line of defense against um, propensities of decline. Also, our brain health affects our overall health and well-being. It's interrelated with all of our organs and our functioning. So the better cognitive fitness you have, the better off you'll feel, and your overall health will be better.
But isn't this cognitive function just a part of our normal aging process? I mean, don't you think that we normally have a decline in our function as we age?
Yeah, you know, there is a part of aging that does include some cognitive decline, which makes it even more important to build what we call a cognitive reserve. So essentially, you want to fill your bank account of cognitive abilities as much as you can, especially while you're healthy, so that you can take advantage of some of the cognitive exercises and skills that are available. Um, Creating that cognitive reserve so that when stress and illness hit, you have something to rely on is just like having daily exercise routines that help with your heart and lung functioning in case you get um, the flu or bronchitis or something else. You'll have a stronger reserve to help weather some of those things that may come up. Additionally, you know, prevention is a real big part of stalling this extreme in cognitive decline, which we might see in something like dementia. And if we can delay a neurological disorder like dementia through cognitive fitness, we want to try to do it when we're healthy and can take advantage of some of these skills.
Got it. So, what you're saying is that I like your analogy about the this account, savings account, as you mentioned. So does it mean that when we have a higher cognitive reserve, that may potentially act as a savings account, and perhaps if our checking accounts goes down, that may kick in and kind of like compensate for some of the loss. Do you think that's a reasonable analogy?
Yeah, you know, evidence suggests that the more we do now to build that bank account, the more we can draw from it later. So that the symptoms that may appear in other people of a certain age are less likely to manifest in your day-to-day functioning.
Do you think people who are highly educated or have done high level of cognitive functioning in their lives, like musicians or like accountants, do you think they have a higher cognitive reserve?
Yeah, there are a number of factors that contribute to high cognitive reserve. One is education. Another is exercise, being physically fit, monitoring nutrition. engaging in challenging activities. You might not have done it academically, but maybe in your career environment, you've been high achieving, or in your life experiences, you've engaged in a number of novel stimuli. All of these things can help improve your cognitive reserve.
Okay. So, do I, thank you for that. It's a very good explanation. Now, do I really need to work on cognitive fitness? If I don't have any problem, like say I'm a fully high functioning individual, or I do well on a average day-to-day basis. Do I still need to work on this cognitive fitness?
I think that's the same thing as asking, like, do I need to exercise if I'm not sick, right? Do we need to work out during the week if I don't have any symptoms, if I don't have the cold or whatnot? And the answer is, it's up to you. But yeah, if you want to take advantage of your cognitive health and delay illness in the future, if you want to create that reserve and maintain a lifestyle of wellness, then the more you engage in cognitive fitness today, the longer you'll be able to maintain that health. Otherwise, you're more likely to get sick, whether it's a neurological sickness or otherwise. So, it's that age-old question, do I need to exercise? Depends on what you want. And, research shows that for an illness like Alzheimer's dementia, the pattern, the etiology, or the reason behind it often starts 15 to 20 years before we even see the symptoms of Alzheimer's. So you want to start participating in exercises and routines that are going to help delay that. If they're starting 15 to 20 years before you see it, you want to start now.
Got it. Thank you. That's very critical. Now, I just want to switch gears. Let's say, I already have some problems with my memory. I'm getting forgetful. I'm concerned about them. Do you think it's too late for me to do this now, or have I missed the bus?
Yeah, I'm asked that a lot by patients. And the fact is that we have a number of research findings that indicate that cognitive fitness and even something called cognitive rehabilitation can be effective for people even experiencing mild to moderate dementia. So no, I don't think it's too late. It depends on how the exercise is applied. So depending on where your cognitive fitness level is, the exercises are tailored to that. So they may change a little if you're already experiencing problems, but is it still effective? Definitely.
Got it. Thank you, Dr. Sumner. Let's switch gears and, talk about what does a cognitive exercise look like?
Yeah. So exercises often use a combination of brain stimulation games, learning strategies, and then lifestyle modifications. So all of these work together to strengthen various cognitive areas. And there are a number of different cognitive areas or ways that we learn information and understand it. They might be memory, language, attention. And so exercises are tailored to which domain you want to work on.
And how would you know which are my strong and weak domains?
Yeah, so it's really important to get a baseline assessment, even if it's just a brief cognitive assessment, to see where you fall compared to other people of your same age, education, and gender. It gives us a nice picture of what your strengths and weaknesses are. Obviously, we're going to use some self-report. What have you been experiencing in your day-to-day? But having a strong quantitative tool, something that has data to support it, will give us a firm place to start from, and then we can reassess as we go through exercise programs to see if you are getting any better.
Got it. So essentially, you're gonna understand what everybody's strong and weak areas are, and you're going to focus on the weaker areas.
Yeah, so here at Kaizen Brain Center, for our cognitive fitness program, we would have you come in and do that baseline assessment so we can find your strengths and weaknesses. And we would actually use some of your strengths to help with the weaknesses. We want to take advantage of the things and the skills that you've already developed. But then we tailor exercises to address those specific weaknesses. And we want to work them out so that they become stronger and they can also become strengths like the ones you started out with. And then we want to reassess periodically to see if you are improving, if these exercises are working for you. Because if not, we need to adjust them. You know, just like a personal trainer would do at the gym. They're going to adjust an exercise if they see that it's working or not working. They're going to correct your form, your technique. You do the same thing with cognitive exercises, because you can learn the skill, but it might need tweaking here and there. So you need kind of a personal trainer for your cognitive fitness too.
Good, thank you. And that's actually a very good example. So basically, as we go to the gym, we don't want to, if you have strong biceps, for example, we just don't want to work on the biceps alone to make them more stronger. What we want is to work on other muscles so that we have a more uniform muscle growth, correct? So
yeah, it's just like the body, they work hand in hand, right? If you exercise one thing, it's going to hurt another if you don't work in combination. So cognitive fitness exercises need to be used together in appropriate ways so that you're taking advantage of them. If you don't do it with proper instruction, you could do it wrong.
So is it wrong to say you're a personal trainer for the brain?
That's how I think of myself. Yeah. I'm a cognitive fitness personal trainer.
Got it. Thank you. All right. So you talked about, what the exercise looks like, and we have a pretty good understanding of what it means when somebody comes to the clinic and sees you. Now, a couple of things about that is, people already do that. Like there's things like crossword puzzles, Lumosity apps. People usually, especially now with the COVID-19, people are more and more using this online apps and training programs that are out there. Now, how different is it? I mean, what are you going to do differently than the people already have?
So in terms of crossword puzzles or word search games, they can be useful if used the right way. If crossword puzzles are stimulating and they can remain novel and challenging, then they're going to be helpful. But what happens is sometimes people pick ones that are too simple, or they become so routine that they're not novel anymore. They're not creating any challenge or exercise for the brain, and so they're not going to be helpful anymore. You need to find ones that are going to suit your skill level, and that's kind of where that assessment comes in the beginning. Additionally, crossword puzzles only address one area of cognitive functioning. They don't look at the overall picture, and they're definitely not working in conjunction with other types of strategies. So it's just one small piece of the puzzle. You really need to use more tools to exercise your brain than just one, like a crossword puzzle or word search games. Now, in terms of like these brain game apps you might find on your phone, evidence suggests that a lot of these brain game apps will only help you get better on the games that are within the app. Those skills don't always translate to everyday functioning. So a little cognitive stimulation every day, great. I think it's a good way to engage the mind, but you have to combine it with other skills, other exercise routines that are going to challenge your brain in ways that apply to everyday functioning. So that's where someone like a personal brain trainer, I guess, could come into play and direct you into how to apply these skills that you get in a brain game to, everyday learning, memory, attention type activities.
Thank you. So one of the frequent questions, of course, I see patients and most of them are doing some of this exercise already, like Lumosity or some crossword puzzles. Now, one of the frequent questions they have is how often they should do this. There's really no clear data on that. How much time they should spend on it, how long they need to do it. So do you have any insight on this?
Yeah, I think you bring up a good point. You know, evidence is still lacking as to the duration and the frequency that you need to do cognitive fitness exercises. But in general, we understand that you really need to weave this into your everyday activities. So you might spend 15, 20 minutes doing a cognitively stimulating game, but then you need to find ways to use those same strategies in your chore list, in your to-do list, doing work activities or at home chores. There are things that you can do that you're already doing every day that you just introduce some of these skills. So we want to kind of marry these new exercises with what you're already doing. That's where you're going to get the most bang for your buck. So when in that regard, you're doing cognitive fitness every day. You want to try to challenge your brain every chance you get. Obviously, you need to weave rest into that, but you know, it's just like exercise. The more sedentary you are, the more you sit on the couch, the more you're going to pay the price for that. You know, you just want to get up and walk. Just like with your brain, you want to kind of challenge it a little bit here or there. There are different levels of challenge, but you want to stay engaged.
Got it. Thank you so much. So great. Thank you. You talked about what is cognitive fitness. Why is it important, and what happens when as we age. What's a normal decline? What's an abnormal decline? Who can use it, and how they can use it? And and I think your program is amazing because it's not just a cookie cutter approach to one-time training like for everyone, like most of the training programs out there with apps or other things, but rather focused, very personalized, right? So what you're trying to understand are the weak and strong areas and design a specific program that is closely delivered, monitored, and and personalized, changeable, based on you know longitudinal assessments. So you know why do you think your program is better than anybody else's out there in at least locally here in San Diego, or for that matter nationally?
Yeah. You know, I think there are lots of good resources out there. I think what's unique about us here at Kaizen Brain Center is we really try to combine the best of those resources. So we use evidence-based tools. We find the best brain games to do cognitive stimulating exercises. We do assessments baseline and then routinely so that we make sure those stimulating exercises are actually beneficial. We find ways to tailor new cognitive strategies to different everyday activities you're already involved in, maybe introducing some new ones. And we monitor you very regularly. We have weekly appointments so that we can address any problems that have come up, answer questions, um, tweak any issues that we see, any problems or ways you're doing exercises that may not be the best way, and really try to serve as a constant support. We offer a breadth of tools. We utilize some of the most recent findings in literature to apply cognitive training skills that have shown to improve memory, attention, other various thinking skills, and we really try to stay on top of what works for you as an individual, and tailor what you need in your lifestyle right now.
Got it. Yeah, absolutely. I think what you're saying is a very critical aspect. Independently, at Kaizen Brain Center, there's always been a focus on brain health. Overall, and brain health is kind of like has a lot of things like there are a lot of factors influence brain health. For example, your lifestyle, what you eat, how you exercise, how you sleep, how you move. So what you're saying is that all these things are also being taken into account for when we develop a cognitive training program, because those will have a huge impact and they will work synergistically with the cognitive training, brain training that you have. So that's
Yeah,
how we had the success stories.
a cognitive fitness program must address the whole body because the brain does not work in isolation. So we look at physical fitness, we look at nutrition, sleep, stress reduction, social connection. All of these areas interplay with how our mind works, how we think, how we gain knowledge, and how we understand. And if you leave one of those elements out, you're not going to address overall well-being and improve your cognitive health the way it needs to boost that reserve we talked about.
Got it. Thank you for that clarification. So one of the question I have, as a clinician is, when what are the patients that I should send to you? I mean, when I see patients with, having some trouble with their overall brain health, it could be their cognitive functioning, they're having some memory changes here and there, they're forgetful, they're not able to plan and organize things, or they're having some low degree, some depression, anxiety issues, or sleep difficulties. What are the people who I should refer to? Who are the, what should be my criteria? Do you have any guidelines for me as to when I should refer my patients to you?
Yeah, it sounds silly, but everyone, really, we work on a continuum. So those that are free of symptoms and doing well can still benefit from a cognitive fitness program. Just like anyone that's generally healthy can benefit from a personal trainer at the gym to tone muscles, to increase strength. We can all improve. We're constantly on a journey. Our brain is the same way. It's a constant process of learning and understanding. So even if you're doing well, you would benefit from this. If you want to improve, we can help you improve in specific skills. If you're already struggling, there are strategies we can put in place to help you compensate for those struggles. So from the healthy to those that are feeling cognitive decline interfering in their lives, we're here for you. There's something that we can do. That's the tailoring part. That's where the expertise comes in finding how to work with you where you are.
Got it. Thank you. One other area where, to give a clinical example, I think we share some of our patients. Some of the patients I see executives working at, biotech firms or, technology who are very highly functional. They are very smart. And when I see them, sometimes they have trouble with their baseline functioning status. Like now they're saying, I'm not as sharp as I used to be. Now do you think that you can help these kind of top-notch executives or high achievers, by, like, is there a role for cognitive training for these, this subset of population?
Yes, I've seen a number of really successful individuals that just kind of need a little boost, kind of booster sessions here or there to help them weed out some of the stressors that come into their life that start to impair optimal cognitive functioning. I think a lot of high achievers take on a lot of extraneous responsibility and work, and so that can build over time. So it's finding ways to weed through that, increase planning, organization, or a lot of what we call executive functioning skills. So, there are areas of the brain that carry a lot of the responsibility for managing, organizing, and planning. And so you can do drills and exercises that can help improve that skill set, and learning ways to, or new strategies to help do things a little more efficiently or better.
Thank you. Thank you for clarifying that. So in summary, I think, I'm a believer of cognitive function. I mean, since, I had done my research way back in 2009, looking at, various cognitive training programs across various spectrum of disorders. And since then, I've been a big advocate of that. And I think, especially now with the COVID-19, I think a lot of my patients have been asking is, I can't go out. One of the critical element of cognitive fitness is socialization. I think that's a very important skill. Now that's not happening. There's a social isolation. Do you think that it's even more important for especially our elderly population who are stuck at home in nursing home to actually be more proactive in doing cognitive fitness program such as yours?
Definitely. Some of the downsides of COVID are isolation and also kind of lack of novel stimulation. We're doing a lot of routine sedentary behaviors. And those kind of are big red flags in terms of achieving cognitive fitness. So engaging in a program right now that's going to help keep you, on top of some of those activities is what you need. It's really kind of one of the things that should be primary and focus right now, because we don't know how long this is going to last, and especially if you have underlying conditions, or you are in an at-risk population, you need to focus on things that are going to help your cognitive health right now.
Got it. So, my follow-up question after that is, a lot of people who are, elderly population are perhaps don't have a lot of access to technology, or the minute you say like a brain training program or something like that, there's this little bit of, anxiety about whether or not they can utilize this. What are your insight on that?
I'm actually kind of used to working in both spheres, with technology or without. I've worked with a lot of patients that have traumatic brain injury, so being on technology actually exacerbates their symptoms. So there are a number of tools to use that don't even involve technology, whether it's old paper pencil type activities, workbooks, reading material. Those all can be utilized for improving cognitive fitness. You don't have to have a computer or a smartphone or a tablet. They're useful, but there are other ways.
Got it. So would you be getting your patients into the clinic, or they can just do this from their home or nursing home?
We offer both. So we do have weekly telephone appointments to check in with our fitness trainers. We offer an online assessment platform, so you can do that baseline testing over a computer, or you can come in and we can do the baseline testing here with me, and you can meet with our fitness trainers. So the option is yours. You choose what works best for you.
My next question to you is, at Kaizen Brain Center, we see a lot of patients with memory issues. Some of them have normal aging memory decline. Some of them have mild cognitive impairment or early Alzheimer's. So, I believe that these conditions not just impact a person, but as a family, there's an enormous caregiver burden. So do you think that when my patients with, say, mild cognitive impairment, which is a stage that comes before Alzheimer's, or early Alzheimer's, or anybody who have memory issues, when they do your cognitive fitness program, do you think that perhaps directly or indirectly there might be some relief for the caregivers, or like in terms of the burden of care?
Definitely. Being part of a cognitive fitness program where you have weekly check-in sessions, it creates a monitoring program. So we know how a patient is doing, whether they are declining for some unknown reason, whether they're staying or maintaining their overall cognitive health, or getting better. But having that feedback go directly to the caregiver, I think, is essential. We work as a team, and that's not just a Kaizen team, but it's also the caregiver and the patient, because if somebody is experiencing cognitive weaknesses that meet diagnostic criteria for mild cognitive impairment or early Alzheimer's, you want to work with the caregiver so that they know what's going on, they can help with the exercises, and they can also know that somebody else is checking in, that they get feedback and understand what their family member or the person they're responsible for is going through, and if they really are struggling more than they think they are, or they need a little bit more help.
Thank you. Thank you. Well, thank you so much, Dr. Sumner. That was very insightful. Gives me also a good idea about what I can do for my patients who have this without using medications. Perhaps this is one of the tools we could use for some of the people who have, some cognitive changes as a result of perhaps normal aging, or perhaps who just want to improve their cognitive reserve, by
Yeah.
doing the right kind of an exercise. So I think it's very critical. I think if I were to do this, rather than just jumping on some, cognitive exercise platform and doing it, I would rather be guided by somebody such as you to tell me what exercises I need to do. And I think close monitoring is very critical. Well, on that note, thank you so much for for today's discussion, and hopefully we'll as you start the program, this is probably, correct me, I mean there are cognitive training fitness programs and stuff, but I think your program is quite unique, not just based in San Diego, but nationally, that because of the things that you've incorporated in the program. It's not a cookie cutter program, but it's very, very personalized, correct?
Absolutely. I think to get real benefit, you need to tailor it to the individual's strengths and weaknesses. If you work on kind of a generalized level, it's not the same challenge. And you can't tell everybody that they need to go run 2 miles every day and they'll achieve the same physical fitness. It depends on how you came into the situation and what your needs are. So you've got to personalize the experience.
Great. So one last question before I wind up is, when are you starting this program?
It's available immediately. If you have clients that are ready to participate, then we're ready to accept them.
Great. I think I do have a lot of people who perhaps may benefit from this. Thank you once again, and it's a pleasure to have you on board and part of the Kaizen team as usual. We'll keep as we start working on this program together as a team, and then we'll create subsequent series of educational videos for our patients who can benefit from this. And
Thank
even
you.
general public who does not want to be a part of the program, but can, it's always our focus has been in education, and so I think it's important that we continue this series of talks in the future.
Absolutely. I mean, there are so many more caregivers out there that are not getting this information, and maybe just the patients are. So just spreading it to whomever can utilize it, I think, is a bigger goal that we have as well.
All right. Thank you. Thank you once again.
Take care.